Hi, good morning, everybody. Thank you very much for joining us this very, very important webinar. Well, let me share with you one story. Actually, a lot of people don't realize, even though a pre-diabetic or diabetic, it's so important to get your gut really have healthy gut so you don't get constipation. Now, a lot of people thought, well, a lot of time you feel constipation, you don't feel good, you feel bloated, it's hard to go, you want to go, you cannot go. All these issues can be very psychological and also physiological problem for all of you. So that's why I thought that maybe it's really good to actually have this webinar. And I'll share you with you also, if you don't look at it carefully, it might be a serious problem. A recent friend of mine, which is a fairly elderly mother, 72 years old lady, who basically did not really have a very good bowel movement all the time. And suddenly, as time goes on, more and more frustration and can't make it. And one day, what she did is she did not take good care of it and forced how to do her bowel movement. Now, with that force, nobody know whether some of the vessel in the heart or some of the vessel in the brain can take that force. Because when you take the force, there's a lot of actually pressures that going boom, and net result, she has a stroke because of that. Now that is really detrimental because you have a stroke, you have so much healthcare problem coming along. You lie there, you cannot move, and all that. So it's very regrettable. So I thought perhaps today we can able to provide you some information that able to help you to have a very good healthy gut. Net result, you eliminate all these problems and continue to have very wonderful, easygoing every day or every other at least, but not to get constipated. So today's lecture is that's what it's all about. And I thought it would be very good for everybody, for pre-diabetic patient or diabetic patient, or even elderly folks have the same issue. You can use this to look into it, and then that result, you have very easy bowel movement. That would be wonderful for life, rather than I'm struggling again today. Oh, it's so bad. So let's do it. And shall we start? So I'm gonna start off and basically get everybody ready, and then we'll go from there. I want to make sure that our friend here can able to see our slides. So thank you very much, Edwina, to come over. Many of our regular client, which is so good to join us. Edwina, can you give me a one if you can on the question or whatever that you can give me so I can able to provide understand you are doing good. You can do it in a questionnaire or also on the chat is okay too. So give me just let me indicate that you are actually seeing it's good. Okay, thank you. Anyway, today's topic is how type 2 diabetic or pre-diabetic trigger constipation and how to find your relief and able to do right. Okay, so this is something that is really can be helpful if you know that and you can know how to do it. Wow, that would be so wonderful. So really, this is the topic of today, and I think this is going to be a very good lecture for you to understand and also able to get you to share this with all your friends and things like that. Eventually, you can actually even help yourself relieve a lot because if you don't get your bowel movement out, you can bother you whole day long. Okay, so today we will talk about how high blood sugar affect your digestive bowel movement. What is the diabetic? If you're diabetic for some time, is actually create nerve damage, and because of nerve damage, you will create constipation issue. And how to a safe and natural way to find this kind of relief to relieve every day have bowel movement or every other day. It's not going to have keep forcing it out. So what food and habit and supplement able to help you to better to get the digestion going and also get your bowel movement going. And also when you have really constipated, what kind of serious issue you can come by. And now a lot of people don't realize that it is very serious if you don't do it right. Because as I said, my 70 something years old friend, because of this constipation, caused her to have the stroke, which I think is terrible. It's unnecessary. And really, she can actually get that relief, and she doesn't have that really a sad outcome because of the constipation and create a stroke. Because your stroke, tremendous medical cost. You lie down, your life, uh, quality of life is tremendous drive down. So I don't want you to go on that road. So let's work with me together to better understand. And you make yourself happy, make your gut happy, make you at least free of this kind of high risk. That's what I'm trying to do. So today we'll also teach you, well, how low sugar can help. So anyway, that's how we go. Shall we start? Now, in my name list, I saw a lot of strange people that I have not meet, or new people, not strange people, new people I have not meet. So I always want to catch up with you guys. What is diabetes? How do you start from there? Now, there's usually called 4 stage. What I want to catch you is before you even go to pre-diabetic, you already start doing things, and that will help you to have eliminate all these future problem or medical problem that you derive from the pre-diabetic problem. Okay, so the first stage, usually the LDL, the bad cholesterol, goes up. And now when the LDL cholesterol goes up, then it will damage the B cells, which is from the pancreas that issue the B cells up and take the sugar into the cell. That damage, you have more and more sugar in the bloodstream, and net result, the high LDL cholesterol and the blood sugar mixed together, the blood become very thick, and that's the problem start, because it start plaquing all the walls of the vessel. So here, then you very quickly move to stage 2. Now, really, all diabetics start with that. Is really the problem is all these plaques is going to form blockage throughout the vessel, throughout the whole body, your brain, your heart, kidney, everywhere. So net result, your blood pressure will start raising up because you have less space on this vessel. You notice the vessel being very less space, and your blood sugar going up. So your net result, if you long time go on, you can have all kind of health issues come along. Now, at this stage, you have no pain, nothing. So you will not much motivated. Your blood pressure is only go up to 130, 140, 150. You have no idea until you go to a doctor to check up. Oh, my blood sugar goes up. Oh, I'm now becoming pre-diabetic. Because a lot of time when that happens, you very quickly move to stage 3. Now, when these blood vessels are blocked up, you will never come back, it will continue to block. It will not, you cannot get a brush in there, brush it off. So you really got to start early, prevent this blockage. Now, once you get to stage 3, which is your pre-diabetic stage, every doctor will measure the same thing. They will measure your HbA1c. Now, the HbA1c, what it does is measure the amount of the percentage of sugar attached to your hemoglobin cell, red cells, okay? Now, with that, if you are 5.7 and below, you are a normal person. If you're 5.7 to 6 and 4, now you're pre-diabetic. A doctor usually say, hey, Mr. So-and-so, you are pre-diabetic now. You really take care of yourself. You have to cut down the carbs intake. You have to exercise. You have to lower your weight. You have to measure your blood sugar. Now, and doctors say, I can't give you any medication because you're not diabetic. That you really got to change your lifestyle so you can continue to drive your A1C below 6.4. Now, a lot of people hear this, what came in, what go out. They are not motivated yet. And a lot of times they say, yeah, I will do that. They will do that 1 month or 2, and they disappear. They don't do anything anymore because nothing happened. Now, really, at the end of the day, you have one item can truly help you, is low sugar tea. You can have low sugar to help you to maintain better blood sugar levels, and that's what we suggest you can have. Then you can continue to have that, and you lower your A1C. Now, you don't do anything, you don't change your lifestyle, because changing lifestyle takes 6 to 9 months to really get the habit to change. But you don't do that very quickly in about matter of 2 to 3 years or 4 years, you will become a diabetic. Now, once you're diabetic, unfortunately, it's bad. You cannot reverse that stage, and the doctor will put it on the record you're diabetic, and that result you buy insurance, and insurance goes up, costs go up, and some company don't even want to take your insurance, and they'll kick you out. Matter of fact, I've quite a bit of customer with me that because of that, the insurance company either raised the premium very high, or they say, I don't want to take care of you anymore. So what they did is come in, they take low sugar and drive the blood sugar lower than 6 and 4, so it got him back the program. And that is something that a lot of people do. So that is something that you might look at. Now we'll talk about low sugar. Why low sugar? Well, first low sugar have two things. One is the guava leaves that delay blood sugar going into the bloodstream. Secondly, they have bitter melon, which is very good. It has increased insulin sensitivity, takes sugar back to the cells, and also excess sugar, cholesterol, and salt. They dump that out urine, and that result, your three high come down: blood sugar, cholesterol, and then blood pressure. And plus, they help you detox. That's the reason why you need to drink low sugar tea. Now, we are not just asking you to drink low sugar, because we have a program which teach you how to do low carbs and low fat diet, teach you about exercise, 8 to 10,000 steps a day. And then we also help you to control your BMI. You need to lower your weight. If you're 30, help you lower the weight 23. It take works. It won't happen by itself. And then we have doctor webinar or a medical personal webinar like myself, which give you free webinar throughout every week. And our webinar has now 360 or more webinar for you to look at. And basically, you just go on English YouTube webinar, go to youtube.com and say at CTT's low sugar /video as CTTEASLOWSUTEA/video, VIDEOS. So all you do is look at this one and go to your video, your YouTube, and look at it. And there are 360 plus YouTube for you to look at. So you can take it at your own time to look at the video. And we have helped many people, even the A1C as high as 10+%. They drop it down to 5.7, or they go under 6. So net result, they can be really, really healthy and eliminate all the complication that you might face if you do not do anything. And that's a tremendous amount of health complication, including stroke, heart attack, kidney damage, and everything. So I don't want you to go on that road. So let's talk about why diabetic has and gut health is so important. Well, very simple. Gut health play a very important role on weight management and then also diabetes control. Because if you can able control gut health, you can control diabetes and weight. Wow, that's wonderful, isn't it? Now, the gut has a lot of microbe, and that is like lots of real healthy bacteria. They stay in your gut and help you to really digest and play many, many different roles. And you really have to have those microbe in your gut, okay? But if you don't do it right, your poor gut health will lead to really you get too obese because they don't digest well, plus diabetes because it make you to be having insulin resistance and all that. So, but gut bacteria is very important to help you to absorb food, absorb nutrient, and regulate energy, and also give you this thing very important is not to inflame your gut, so you have good resistance. So healthy gut can really maintain healthy weight and also blood control sugar. Now, so that's why gut health is so important. Now, a lot of people are not sensitive to that. I would say a lot of people don't realize that is important, but truly that is extremely important. Now, why this link imbalanced gut microbe and diabetes will be important? Because what happened is the microbe help to break down the food and absorb the nutrients and produce so-called a short fatty acid. It's like a fatty acid in the process. Now, it's a short term. It's called SCFAS. Now, what this FAS does is actually help you to decrease inflammation, also prevent you to get like cancer, for example. And this is so important. So those bacteria is important. Now, if not, you don't have enough of that, or you have not good microbe, so you have inflammation. Now, the inflammation create imbalance of microbe, lead to chronic inflammation, and impair your insulin sensitivity and affect your blood sugar regulating. Now, that all those things are not good for you. So you want to create less inflammation to your gut. On top of that, if you continue inflammation and gut not processed correct, you might even have leaking gut. Okay, and what it does is the lining of gut damage and the bacteria of the byproduct, which is called LPS, leak into the bloodstream and cause further inflammation, and that result your insulin system go even higher. Now, really, also when you do that, you also alter all the metabolism of the gut bacteria, and what happened is your digestion system of carbohydrates, of fat, and all those not doing well. Then that result, you're increasing blood sugar going up in the bloodstream. And the blood microbes also help to prevent harmful bacteria to take over. So you don't have that process good. The harmful bacteria will take over, will continue to have a lot of inflammation, and actually all the even the immune system are being affected. So you don't have good immune system. So that's why the microbe is a really important so-called gut soldiers for you to help you out. So don't sort of forget about that guy. Okay, that is a good guy. Okay, now, so let's talk about, well, really, and then what is so-called constipation? Is it every day I have bowel movement, next day I don't have that, I'm constipated? It's not true. They have actually standard measure. So if you have fewer than 3 times a bowel movement, you basically started your constipation. And stool consistency also, when look at it, is very high, dry, a lumpy stool. And also when you go, you have very painful difficulty to go and very discomfort. And also the worst thing is you don't completely relieve all your bowel. Somehow you just feel something still in there, not completely removed. So I thought perhaps I'll give you one page of how an actual stool look like. For example, you have all the stool come out. It's like all these little nuts like that, you are constipation. Or you have bowel that is like a bunch of lumping here, one and lumped together like a sausage. That is also you have a constipation. If you one by one, like a lump like that, like marble coming up, that is severe constipation. Now, certain normal bowel, you basically are like a sausage. That's what you want to do. You want to have type 3 and type 4, normal bowel. That's what you look for. So I'm sorry, I have to share with you to what to look at. That's why I'll give you some poop, normal poop, what it look like. Sorry about that, but that is something you should look at. Now, also, commonly, as data show that at least right now, the new studies that at least 16% of all diabetic patients will have some kind of constipation issue. But the previous study actually says 60%, 60. And I think at the end of the day, I think 60% is actually a fairly good number, because I heard so many patients kind of come back to me and say, hey, Andrew, I need some help, man. I really have a lot of constipation. And so I believe that 60% is really a lot of diabetic really have long standing of some kind of constipation they need to deal with. Now, really have you understand why diabetic or pre-diabetic will have constipation. That is important because one, when you have vascular nerve damage, in other words, because diabetic, as you remember, we always talk about, besides you have vessel issue, the one other thing a lot of people are not sensitive to is the nerve issue. The nerves will get damaged. And when that happens, your blood sugar is harming all the blood vessel because a lot of sugars around there, plaque and so forth. So create the vessel become hardened, and also start damaging the blood coming through. It can, at the back, you damage the nerve because it can't come through because of the blockage. So net result, all those nerves are being damaged, and now you start getting impaired damaging digestive system function. And then you will lead to, this is called diabetic neuropathy, meaning that your nerve damage is start affecting all the nerve on the gut area is damaged. So everything start getting not functioning well. Now, with that, you also weaken the gut muscle. Now, gut has to have a lot of muscle to push. It's called peristaltic movement, like that, moving like a wave. Now, when you have all that, it's start weakening those muscles. You're not going to do so well to push those, stool out. So reduce, and plus, nerve damage also reduces sensitivity and the strength of the gut muscle during digestion, and also pushing all the bowel movement, stool out. Okay, so weakening a gut muscle is also has some effect to your constipation. And also, you're going to have sometime, if you long term having all these issues, you cause gastroparesis. In other words, basically your stomach is start delaying emptying your food into the gut. So net result, you're going to start chronic constipation. Now that would be sad, right? Because the stomach just don't release the food down to the gut to start a process. Slowly doing, eventually you get very slow, and now you have an issue of truly a chronic constipation coming. Okay. Now, another one is dehydration. Now, that's the reason really low sugar tea can really help you, because poor blood sugar control often caused by you have a lot of urination. You know why? Because the body will say, I need to dump out this sugar. So you have a high blood sugar, you also dump out a lot of fluid, a lot of urine. So end up, you lead to dehydration. Now that also because of not enough fluid, your stool become hard, make the bowel movement very difficult. That's the reason why every day I ask you guys to drink 2 liters of low sugar tea, and that is the reason. Now, also medication, some diabetic medication related treatment, like for example, you're gonna have a lot of nerve pain, neuropathic pain. Okay, so they might give you some gut medication to help you out. Those medications can affect your mobility of the gut. So net result, then you now have constipation also. Now, also diet and lifestyle. Now, diabetic diet may be lack of sufficient fiber. Now, actually, you need to have a lot of fiber, but a lot of people somehow don't take that. So they have not a balanced diet with, a lot of fiber and a lot of good stuff that help you to move your bowel. So you are basically not getting enough fiber. Plus, I noticed many of the diabetic patients, they don't move around. They don't do exercise. So net result, their physical activities are very minimal. So then they further slow the digestion, because of the fact that if you're physical, you walk 10,000 steps or 8,000 steps, you will help you to do help you on the constipation. Plus, if you have bowel obstruction or paralytic ileus disease, which is caused by nerve damage from diabetic affected intestinal movement, that definitely severely affect constipation. Now, if you have, for example, this kind of problem is like you really have a severe stomach bloating, pain, nausea, vomiting, inability to pass gas, meaning that you gotta have passing gas or stool. So more important, you have to check. The first thing you don't have stool, you make sure you pass gas. Okay, if you pass gas, at least you're in a good shape in somehow. But if you don't pass gas, don't pass stool, then you really gotta check. Plus, you have now other complication coming in is the risk of bowel leaks, and you leak, into your bloodstream if not treated, and that is going to be causing a serious problem. So all that, you will come up with other disease like celiac disease or irritable bowel syndrome. All these adding on in the factor that is not good for you. And somehow this is really important. That's why you have to understand where you're at. You really gotta work on and also get doctor to help you to treat. Now, lifestyle is also important. a lot of diabetic patients, they tend to lifestyle didn't change much. They don't exercise, they don't lose weight, don't lower their weight, and the medication they also taking that they might trigger them for constipation. Now, if you really don't move, very little activity, I only watch a lot of TV, I sit on the couch all day long, I keep eating a lot of pizza. Wow, that would be a terrible thing because what happened is if all these you don't move, it slows the intestinal mobility. So you don't move. So you really have a problem of you are basically have a natural contractions of the colon. And that result, your movement of the colon is tend to move very, very slowly, and then that result you really amplify more and more other issues come on. For example, nerve damage already impair a lot of the contraction of your bowel, but with you don't move, it tend to further constrict that, then you are worsening that constipation. So you gotta move, you gotta walk. Even though it's I'm tired, but go ahead and walk 10,000 steps. No, I cannot do 10. Well, go 3,000 steps, then 4,000 steps, 5,000 steps, and then move on to 10,000 steps. Now, a lot of people say in Hong Kong, say, I'm too hot. Well, go to walk around the shopping mall. And then you can get a step master if you would. And that really work right at your sitting room. You don't need a lot of space, or you do a step master and you move up and down your arm with a bell. You can do that. You definitely can do that. Whether if you try or not, you gotta encourage yourself to move. Now, one of the things that a lot of people don't realize, your lifestyle change, you gotta really make sure that you have, besides that, you have earlier the don't move medication. One of the things is you do not have fluid or fiber. Now, really, this is something is so important. That's why we design low shuti with 2 liters of water that you low shuti drink every day, because dehydration commonly really in poor controlled diabetic because they say, I don't want to go urination too often. But more often is when you in diabetic, you tend to dump the sugar out, right? So you have more urination coming out. And then net result, you have less fluid in the gut. You're going to create hard stool and difficult pass. Plus, a lot of the diabetic patients, they don't take a lot of fiber intake. They don't take salad and they don't take roughage. So they reduce the stool bulk because they don't have fiber to build the bulk of the stool. And then net result, a slow transit throughout the colon because they don't have bulk. So net result, they were even getting worse constipation. And especially now you have several things hit you. You have the nerve damage, which is called neuropathy, slow the intestine mobility. The intestine move like this, up, down, right? Because the nerve damage, they don't move as fast, they don't move that much, so your stool don't move that much either. So net result, all that come with, help you to go to get more constipated. That's why the fluid, first thing, you have to really get the fluid down. So that's why low shu tea you get 2 liters of low shu to drink every day. And that will help you at least 1 gram to at least decrease the dehydration issue and give you more enough fluid to lubricate. You get able to make a stool. And I found that if you don't drink enough, you're going to have constipation. Now, a lot of people also do not do one more thing. They forgot the urge. When you have urge, do it, man. You gotta go past the stool because you don't want to pass the urge and hold on, hold on. You know what? Pretty soon you forgot, and then you don't pass, and later on gonna make a hard time. So you gotta don't ignore the urge. You have to pass through, go do it. Now, if you don't do it, you know what happened is you start getting the numb of and stretching sensor of the rectum. You numb the rectum basically, and the stretch of the sensor don't have that nerve anymore, or don't react anymore. Then you make it hard next time you make bowel movement. So really, you do not want to hold the stool. When you feel do it, go do it. Make sure to do it. Find a restroom, do it, and then enjoy the time in doing it. Okay. And on top of that, people who have diabetic nerve damage, they usually get worse and worse and worse. So really, at the end of the day, you need to basically, when you have problem, so net result, you feel a little bit urgent, go do it, and then don't wait. I know sometimes it's hard, but you gotta feel, go do it, and just push the stool out. Plus, a lot of times you're drinking water, more water, so you eliminate, you have more constipation to do it. And really, sometimes you might have some laxative. You can do it, use laxative. That actually is doable, and you need to do that so you can release that constipation. And sometimes that's definitely, even have a little diarrhea because of the medication you take, if you will, help you with the constipation. But that is important. So you got to do it. Okay. Now, certainly a lot of medication is the same issue that cause you constipation. One of them is opioids, which is like opium type of medication to decrease your nerve, decrease your pain, because due to sometimes your nerve damage, your pain get worse. But because of the opioid drugs, they tend to give you sluggish contraction of the gut. So net result, you don't get very good gut movement. And also sometimes the antacid also has the same issue. It decreased bowel mobility. So the bowel don't move so fast. So net result, you're going to have that issue. And some of the diabetic drugs, especially the new drugs called GLP-1, they also have some effect. Plus, also metformin, which many diabetic patients takes, they tend to lead to diarrhea. They don't give you constipation, but it does affect your gut flora. So net result, because less gut flora, you constipate might establish. So medication, if you have that issue of constipation, you should talk to your doctor, maybe help you to further change the different type of medication or give you some type of laxative to help you out. That's important. So that communication is important. Now, if you are constantly persistent with constipation lasts more than 2 weeks, now they may indicate there's some other thing that may be really more than just the neuropathy, diabetic neuropathy, or maybe why they slow down colon mobility. You need to look at, because there might be more constipation was more complicated, other issue like intestinal obstruction, colon rectal issue, or maybe a really bad further, getting bad on diabetic issue. So all that need to check on. So if you last 2 weeks very constipated, you got to see doctor. And plus, especially you're now getting a lot of stomach pain, really feel terrible. And then you maybe have serious inflammation, maybe even have blockage of the intestine and reduce blood flow to the intestine. So if you have severe stomach pain and last like 2 weeks, you gotta see a doctor to check what that is. Now, it's also when you have that, usually suddenly have start getting nausea, vomiting, meaning that your stomach or your intestinal issue may be even worse now. It may be lead to, because things are not passing through. Now, especially if you have bloody stool. Now, this bloody stool could be a black stool, total black color stool, meaning that you have some stomach also issue on top of the stomach, maybe some bleeding, gastrointestinal bleeding, hemorrhoid, ulcer, even as much as colorectal cancer can be established. So really, at the end of the day, all these are issues that you gotta get the doctor to look at. Well, you really have blood, why there's blood in your stool, and are you getting high blood sugar due to your diabetic cause you constipated? And then especially if you're sudden weight loss, you're now being fatigued, you lost 30 pounds. Now that will cause you, basically, you got to understand, well, is this a cancer issue coming around like malignancy, which is all that is really come down to something that you got to go back and check with the doctor do blood tests and checks, and maybe even scan, because you have, all the indication might not be beyond not only diabetic, maybe cancer and so forth. Now, so if you really have issue, a lot of time you got to seek immediate attention. If the symptom get worse, you really got to go to emergency room and look for a healthcare provider to help you. You have to keep up your blood sugar monitor, keep track glucose level is not become very high or very low. Really got to stay hydrated. That's why you got to drink no tea, 8 cups a day. Okay, that will really help you to get your diabetic control. On top of that, a lot of people don't realize whatever symptom you have when it start, what happened today, you write it down, because when you write it down, when you got a doctor, you can tell them, hey, I have this problem, which is 2 weeks ago. I cannot poop. I have no poop since 7 days ago or 6 days. So you gave all the history, all the sign and symptoms. So when you tell the doctor, because a lot of time old folks tend to forget, and even young folks forget. So write it down is so important to help the doctor to help them better understand what it is. Now, lifestyle change is also important. You have to reduce stress throughout all these activities like meditation, deep breathing, exercise, really help you to improve the microbiome in your gut. Okay, it's help you on that. So every day drink no tea. It help you on weight management, help you to cut down your blood sugar, cholesterol, and all these part of your daily helps to help you on the gut. It also helps you detoxify and lower your 3 high. Wow, that is so important. Drink no tea. Well, if you smoke, if you drink alcohol, I would suggest not to smoke anymore. Get rid of the excess alcohol, because all that is not helping you improve your gut. If you eliminate that, the gut improvement will work. And you have to work with your healthcare professional. You have to tell them the problem, employer personalize some of the plan to help you improve your gut health and can beneficial achieving, the effective pre-diabetic or diabetic control. So really, you got to work with healthcare professional to continue to help you as a diabetic or pre-diabetic. Get to know. And that's why all these lectures we gave you here, it help you to better understand, so you can now know how to ask the doctor. Now, your lifestyle change besides exercise, weight control, one of the important, you have to really take a lot of fibers, meaning that you have to take a lot of fiber-rich foods like lettuce, eat the whole grain, beans, healthy fat. And on top of that, maybe also good to eat smaller meals, frequent. But don't skip meal though. You stick to a regular eating time. If I eat breakfast at 7, lunch at 11, and then dinner at 5 or 6, keep up that and snack in between at 4 or 3. So you got to do that, and that will help you to better regulate your blood sugar. Plus, you make sure to chew it well to get small plate. When you have the food, you can see, your intake is actually smaller, but in your psychological, it's a lot of food here. So that will help you. And then you have to make sure maintain your blood sugar, whatever level you have. For example, I want to have 125 all the time. Measure that. Okay. In Hong Kong, maybe you said, I want to have 614 all the time. You measure that. So you can make sure prevent you the nerve damage, all the sugar, high blood sugar damage, and must regular exercise. Meaning you have to walk, stretch, or even do Tai Chi yoga. Doesn't matter, but exercise, move. You said, oh, it's too hot. No problem. Do a step mask at home. Do this exercise. And then you have to continue to consist with the bathroom routine. In other words, every day, if I do it at 7 o'clock, if I poops, do it at 7. If I do it at 2 o'clock in the afternoon, do that. Whatever the time you have set, do it. Don't hold it. If you're ready to go, go. So pay attention all these signs from the body, and then now you can just help your body to move through the process. So it's very important to do that. And on top of that, you might try probiotic, because that will help you to get more good bacteria into your body, yoku and all these whatever brand name is okay. Probiotic or yogurt is okay too, but get Greek yogurt, okay? Or prebiotic feed is support to grow this bacteria, so promote diverse good stuff of microbes, okay? Now, with that, because your good microbe increase, it give you more positive impact of your metabolic health, improve your insulin sensitivity, and also give you reduce inflammation in the gut, and then also enhance your digestion and improve your immune response. So, wow, all these are good stuff. So anyway, why low tea again? Low tea is help you to delay the absorption of sugar and also increase the insulin sensitivity. Take the sugar back to the cell, excess sugar, they dumped it off on urine, dump off the sugar, excess sugar, cholesterol, and salt. Net result, when salt go down, your blood pressure go down. So all three highs will actually go down. So important, continue to drink low tea. So taking a blood sugar, blood cholesterol, and blood pressure. Now, so in conclusion, really at the end of the day, you don't want the blood sugar to go up because that hinder your digestion, bowel movement, also nerve damage. So important, the first step, you want to control blood sugar, don't get it go up. And when you have diabetic neuropathy, meaning your nerve start damaging, then it can cause you a tremendous long-term chronic constipation. You know, when the nerve damage, your constipation will get worse and worse and worse. In order to relieve that, you have to be very hydration. You know, where you drink 6 to 8 cup, that's 8 cup low tea every day. Get fluid. You got to drink 3 liters of water today. And 2.2 liters are actually low tea. You want to drink a little more low tea, it's okay. Keep you hydrated. Take fiber intake, physical activity, meaning you walk or step master, get gut-friendly food, and also you have to supply yourself as probiotic to help you promote better bowel regularity. You also need to consult with a doctor if you really continue constipation, like 2 weeks, I don't have stool, or even 1 week, I have difficulty, go talk to the doctor. So you want to make sure that is going to correct it as soon as you can. So today, although it's a very simple lecture, but it will help you tremendously on your gut health. And if you have any question, do write to me, Andy, at wahfong.com, ANDY at WAHFONG.com, and ANDY at WAHFOND.com. That is important. Write to us because I can able to answer your question. Or WhatsApp us, 852-6792-8892. Country code is 852-6792-8891. So net result, if you have any question, do ask. A lot of people do. And they also give you suggestion what kind of lecture they want to hear, so we can actually accommodate a lot of these people. So we are doing really give you a basic informative information to help you. So net result, you will continue to have good health of your gut. You can get your bowel movement every day, and you can say, wow, I feel good. I feel, relief. Instead of every day got bloated stomach, don't feel good, and you feel miserable. We help you every day to become better health care, and net result, you enjoy your life and see your grandchildren for many, many years to come. This is Andrew Lau. Thank you very much for spending time with me in the lecture. I hope that you have good health and have a nice, weekend. And so if you have any question, do write to us. You take care. Thank you very much. Goodbye.